Among the essential workers trying to get vaccinated more quickly for protection from COVID-19 are employees of the MBTA. Many of them are represented by the Carmen's Union Local 589, which has been working with the team management to set up an express line to shots at a site in Quincy. To tell us about the plan and an apparent holdup is the union's president, Jim Evers. Thank you very much for being with us, Jim.
Thank you, Chris. Appreciate it.
I want to start with the situation for people who work on the T right now. Recently, infections from COVID-19 in Massachusetts have been going down. Ridership maybe could be going up again on the T, but it's still not back to normal yet either. So, what do you see going forward in the next few weeks as far as the risk for drivers?
So, and I've said this many times, my members, the MBTA employees, have been coming to work every single day since the beginning of this pandemic. We haven't asked for any special treatment. We haven't asked for any extra special treatment from the governor or anybody. They've come to work, they've done their job, and they're putting themselves at risk. They're putting their families at risk. And I think it's important to be on a prioritized list to be able to get vaccinated. Not only do we interact with the public every single day, it's hundreds and thousands of people that we are exposed to, and they're exposed to my members as well. And not only that, and I know the schools are coming back into play. So we carry thousands of students every single day. So I believe that it's important as well for us to be vaccinated, not only for the ridership, but the students that are coming back as well.
And just for people who haven't been around teenagers lately, when teenagers ride the T, it's hard for me to imagine that they're all going to be wearing masks and staying 6 feet apart from each other.
So that's kind of what I pretty much brought up a little bit in the last couple of interviews. So if we're not going to get the time from the governor to discuss some of these, the situation that we're at hand right now, I believe that I have to take action where my members need to be safe. And right now, I don't think that's the case. We've been patient. We've been waiting our turn, trying to do the right thing and have us vaccinated as soon as possible. But it seems as if the governor has dropped the ball. It's a broken promise. I think if they just opened up the facility that they planned on, that's just sitting there dormant, that it would allow our members to be able to get vaccinated and pretty quick. Not only that, I think that there's capabilities to have the public being able to utilize that as well. So the governor could open it up we could do 200, 300 members every day. And on top of that, I think they can house a few extra hundred people every day. And and that's going to be an issue. And that's one of the issues, and I'm glad you brought it up, is if people aren't going to wear a mask on the buses, I may have to take precautions for our members that the bus doesn't move. If they're saying the governor and the president of the United States is saying that it's mandatory on transit, maybe we adhere to that. And also that, they're not going to have 6 feet between ridership. So maybe we'll have to bypass certain areas, because I know what's going to happen. The T is looking at service cuts right now. They're going to impose some more service cuts. And all that's going to do is drive the amount of ridership up on these buses. And that's going to be a problem.
What about the facility? I understand this is what used to be a Lowe's home improvement store, and it's right near Quincy Adams Station on the Red Line. Sounds like it's a good location.
Yeah, I think it's convenient for a lot of our members. And I believe that the MBTA, with their scheduling, so our members don't work 9 to 5. It's not easy for them. There's split shifts all throughout the day and night that isn't very easily to keep track of. So I think it's a great spot, and it can house hundreds of people every day. And I think if the T is to do this, like I was saying earlier, with the facility that they have dedicated to the testing of our members for COVID, I think they'll do a great job and minimizing the disruption of the service to utilize this.
Well, of course, teachers are also fairly essential workers. They're trying to get things done more quickly as well, maybe with some help from the firefighters. Is that competition for the kind of resources you need for people who work on the team?
So this has came up many times. My brothers and sisters with the teachers, I'm absolutely happy for them. I think they should be. I have 3 children of my own that are going back to school. They do a 1 week on, 1 week off, so it's remote every other week. I think that it's important for them to be vaccinated, but I don't want the governor to drop the ball and forget about transit workers and to bring us up to speed and our priority as well. I think that we should be alongside with the teachers.
By the way, is there an issue about vaccine supply as well? Because it simply seems to me that there's not enough to go around for everybody who needs it right away.
Yeah, I agree, and I'll give that to the governor. But it still hasn't put us into a prioritized position. I know that there could be a wait alongside with that, but just recognize the transit workers. Let us know. We shouldn't have been put in the position that we are on phase 2, part C. Anyway, I think we should have been brought up with the essential workers. So I think just putting us in recognizing the transit workers and the exposure that we have every single day to these members, and it's our lives that are on the online, and the family members of our members. So I just don't want to be forgotten about, and I need to make some noise now to make sure that he hears us.
Because one of the other concerns here is the race against the clock, because even if somebody gets a shot tomorrow, um, they're not going to be fully protected right away, and people around them are not going to be protected from potential infection. So it sounds like time is of the essence.
Yeah, I think there is the Johnson and Johnson vaccine that's coming out. I think they're sending out thousands, and I don't know exactly how many, so I won't. Well, don't hold me to that, but I know that the one shots are coming out, and the folks won't have to go multiple times. So I believe with the timing right now, if they were able to get the Johnson and Johnson shots, allocated for the transit workers and teachers, I think it would be the best move that they can make.
I want to ask you about what things have been like over the past year on the T, because early on in the pandemic, we did hear about public transit workers around the country who got infected and maybe ended up being among the fatalities. What's the case been like here with the MBTA?
So I think it could have been a lot worse. I believe we're up over 300 mark for our members who have been uh, positive. Myself and a few of my board members also have contracted COVID, and thank God that we've recovered. Not everyone has. So I think we owe it to the MBTA. They've done a great job, like I was saying, with the facility that they had in Everett for testing, and being able to monitor and keep track of the MBTA employees was a critical part, and keeping that as low as it is. We did unfortunately have one of our members pass away from this virus.
You mentioned the importance of testing and the location, but what about either the resources put behind that, or even just the leadership effort by team management?
So I think they did a great job. And like I was saying earlier, we don't always see eye to eye. I think they've done a great job. The general manager, Steve Poftek, has been remarkable. Them setting up this facility, I believe they had the green light from the state, from the governor and his administration to do so. And they set this up. It's remarkable. If you guys have the opportunity to go through there, it's a class act. They did a great job, and I give them credit for setting this up. And now to have it taken away so I guess I'll be the voice to help the MBTA do what they planned on doing, and get these vaccinations to our members.
Another question, because as you know, over the past few months, the T has been very hard pressed financially. There were plans for cutbacks. There was pushback on that. And if you look at how much pushback there was from all these different quarters, how did you feel about that?
So we've teamed up with a lot of the community groups. We have some coalitions as well. It's something that this union has really haven't done in the past, but we've made some strides moving forward and caring about what other people's concerns. These community groups and activists have helped us out tremendously. And cutting service during this time is not something they should be doing. There's going to be bailouts more from the White House. For the federal level, there's going to be more money that's comes in for the COVID to pay whatever COVID related expenses that's been put on the MBTA. So they're also looking, I think it's today, I believe, one of the meetings that they're going to discuss service cuts. And to cut service right now, and with the vaccinations coming out, I think there's going to be a higher ridership, and to put more crowding on these buses that need to be. So that's another concern of us as well. Moving forward, cutting some of these routes is going to be a lot more people riding the buses, impact for public safety and our members' safety is an issue.
We'll be tracking that as well. Thank you very much for taking the time to be with us.
Thank you, Chris. Appreciate it. Thanks for the time.
Jim Evers, president of the Boston Carmen's Union, Local 589. We'll have more news in just a moment.